Hey, it's Ashley from Demystifying Your Health. Today we're going to be talking about arthritis. If you don't have it, you probably know of someone who does. It's just a normal part of aging, right? Well, even if that's the case, it still hurts. So what are the treatment options for it? And if you don't have it, are there ways to prevent it from happening? Alright, so arthritis is an inflammation of one or more joints. And while there's several different types, there are three main ones: osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis is the most common type. It usually involves wear and tear to a joint's cartilage, causing it to break down. But it can also be a result of having an injury or an infection of a joint. Regardless of how it arrives, it can lead to bone grinding on bone because the joint's cartilage is gone. Symptoms take years to appear and can include pain, stiffness, redness, and decreased range of motion to the affected joint. Rheumatoid arthritis is actually an autoimmune disorder. So what this means is your immune system attacks the healthy cells in the lining of the joint, or the synovium. This means over time, not only does this get destroyed, but it destroys the cartilage of the joint and eventually will destroy the bone tissue as well. Similar to osteoarthritis, the symptoms take years to appear and can include pain, stiffness, redness, and decreased range of motion of the affected joint. Gout is a little bit different than osteoarthritis and rheumatoid arthritis. This is because it's the result of uric crystals accumulating in the joint, causing sudden inflammation and intense pain. Usually the joint is the one in your big toe. However, it can occur in any joint in your body. The crystals form when you have high levels of uric acid. Your body needs uric acid to break down purines. Our body naturally produces some purines, and others we get through diet. Some foods have higher purine content, such as steak, organ meats, seafood, or alcohol. Usually your body is able to filter it out of your blood through your kidneys and then get rid of it when you go to the bathroom. Sometimes your kidneys don't function as well as they should, or if you've had a high purine content food, your levels in your blood will be higher. In either case, this can lead to the formation of gout. When it comes to treating arthritis, unfortunately, there isn't a cure. So the goal is to manage symptoms while reducing pain and inflammation. So the first step is usually over-the-counter pain medicine. And this is either acetaminophen, which is Tylenol, or NSAIDs, like ibuprofen, which is Advil, or naproxen, which is Aleve. For rheumatoid arthritis, there's a few more options because it's an autoimmune disorder, but these are all prescription medicines, such as methotrexate, hydroxychloroquine, tanorecept, infliximab, and corticosteroids like prednisone. When it comes to gout, the biggest factor is monitoring your diet and trying to avoid foods that are high in uric acid. If for some reason your pain and inflammation is so bad that it's debilitating, your doctor might even recommend surgery to replace the joint. Some other options you can try at home that are non-medication, non-surgical options include you doing like heat or cold therapy to the affected joint, trying physical therapy, and it's also a good idea to have assistive devices like a cane, a walker, raised toilet seats, or grab bars. This just will allow you to be able to do your daily activities a little bit easier. While there's no guaranteed way to prevent arthritis 100%, there are things that you can do to reduce your risk. The first is maintaining a healthy weight, because when you're carrying around extra weight, it's adding stress to your joints, which over time can lead to damage and then obviously arthritis. Next is to drink plenty of water. You want to keep your body hydrated. This also helps with just overall good health. Same thing applies with healthy eating. You want to have a good diet. Know where your protein's coming from. Try low-fat dairy products. Limit the amount of red meat. Obviously, if you want to reduce your chances of gout, try to be aware of what food you're ingesting and avoid or limit the ones that could put you at a higher risk. This includes alcohol and sweetened beverages. And then exercise regularly. This is important for overall good health, but if you're concerned about stressing your joints, try swimming or water aerobics because they don't do this. Arthritis is not just a normal part of aging, and it can be incredibly painful. The good news is there are ways to treat it, and in some cases maybe even prevent it. Thank you for joining me today, and stay healthy.